I had just joined the practice and had come to work probably about 3 or 4 months, and the office manager came to me and said, "Can you see Dr. Langston's schedule?" And I said, "Yeah, I can see Dr. Langston's schedule. Is he okay?" He said, "Yeah, he kind of got his days off mixed up, and he's fishing." And I thought, if you're not going to do one passion, you might as well pursue the other.
When I think of Buddy, I think about a man who's humble. In many ways, I think about him being a quiet person, but really I also think of him as being somewhat of a Renaissance man. He has so many different interests.
Buddy is of the generation of I can fix it. He won't give up, usually gets it done. Might use a little duct tape, but it works.
Everyone's attracted to Buddy. In fact, when I talk to other people, they say they consider him their best friend. I think that's how I would describe him. Everybody's best friend.
I really don't remember when I wasn't fishing. I remember when I was real little, taking a piece of worm and crawling up to the edge of a brook and dangling it down in the water and catching little minnows. And I started fly fishing real early.
He's a perfectionist in a lot of ways, and if you could see him casting, you would understand that.
Sometimes catching one fish is a big day.
Patience is a big part of being a pediatrician, and Buddy has lots of patience.
If we travel and I come back to Gainesville, I always, as I'm coming back in and seeing the town again and seeing the mountains behind us and all, I wonder why in the world did I travel somewhere it's so pretty here, and it really is.
Buddy has been just tremendous in helping to develop the healthcare landscape in this entire region. He has served, of course, as a pediatrician, practicing medicine and taking care of lots of families and children over the years. He came to this community wanting to make it better than he found it, and he has done that in so many different ways.
One of the things with pediatrics is most of your patients get well and stay well a long time. You have that opportunity to sort of surround yourself with reminders of why you work so hard.
He became so attached to the families of the children that he treated. A lot of times he would pick up that black bag and go to somebody's house.
Buddy is known for his kind of mantra, if you will, that if you care for people, then in the process of that, you will give great medicine.
He was always so concerned about making sure that my son, as well as others that I've talked to over the years, that we were looking at the long haul for how to take care of him, for him to grow and progress.
Buddy was a lot of times the go-to guy when you just didn't know what to say. And he always had the right words.
He was that special kind of pediatrician.
He believed that pediatrics, the best of pediatrics, should be delivered to whoever needed it. That got to be the hallmark of this practice.
Buddy has served as chief of medical staff here. He has served on multiple boards and committees for both the medical staff as well as for the health system.
As the medical staff grew, as you can imagine, everybody didn't always agree.
We're all focused on the same goal, the same mission of caring for the patients in this region, but the business of it sometimes can make that more complicated than you would like for it to be.
He was masterful in the way he could bring people together.
He seems to be one who gathers thoughts and feelings together.
He has been very involved with the Medical Center Foundation, really impassioned about philanthropy and volunteerism, and has served in a number of ways.
The difference between a good hospital and a great hospital is philanthropy. People giving money as they can to be supportive of it makes a difference in the amount of healing that can be done in that community.
Dr. Langston has been very strong in his leadership of leading the Downey Society, which is our physician giving club within the foundation, and has served in a tremendous leadership role for a number of years.
To be a sustainer of the giving is the thing that you have. It's just something you add to your budget. And this community does it.
Came back to them. I thought we weren't going to get
actually
in.
turned out to be a pretty good
Like
deal.
got it on us. So this looks like
looks good.
that's going to be real good.
You know, when new physicians come to our community, Buddy feels that it's somewhat of a calling for himself to educate those physicians, to share his story of when he came here to Northeast Georgia.
You joined a civic club, you joined a church, you became part of things, you were asked to take positions of responsibility. When your turn came up, you took it. And that was just the way it was.
An individual, a physician coming to this community needs to understand that it's more than just practicing the medicine. Yes, it's caring for people, but it's also about making this community better. It all fits together.
It's important that if you're in a community, you need to try to be sure you leave it better than it was when you came. At least try to do it.
Buddy has been integral in developing the medical healthcare landscape here in our region. He was a founding member for the Longstreet Clinic, and he worked tirelessly to help that develop.
That was a passion for him, to be able to get physicians together in a multi-specialty group to deliver care to whomever needed it. Not just deliver some care, but to deliver the best care.
A lot of our national consultants were saying, multi-specialty groups like that is not the wave of the future.
Today, Longstreet Clinic is one of the largest physician groups in the state of Georgia and makes a tremendous impact on healthcare in our region, but also sets the pace for improving healthcare and the ways to do that for other groups throughout the state.
I always felt that people that entrusted their child to you, for most people, it's their most precious possession. And that's a great responsibility, but also it is a great deal of trust that's been placed into you.
He's more than paid his dues to this community, but yet, he continues to volunteer. But in addition to that, he continues to challenge the community, that it's also our responsibility to give back. And I think that's one of his strongest traits.
And you wonder, how can you do it all? But yet he does, and it's never in a frantic kind of way. It's in a holistic way that really does make a difference.
He's a very selfless person.
He has such a servant's heart. He's so genuine, and has a way of accomplishing great things in a gentle and a compassionate way. And he is a true hero.
I consider him my best friend. Can't say much more than that about him.